Skilled nursing facility in a pandemic. Roles and responsibilities. Provide nursing care and therapy for after acute infection at the hospital or to return to a prior level of functioning. Provide overflow care for patients in the hospital that are less critical than those with the pandemic disease. Provide respite care for patients who are on hospice that need short-term increase in care related to the pandemic disease, or respite care for patients whose caretakers become ill. The infection preventions that they use, they track and trend infections within the facility and ensure patients' infections have been resolved prior to discharging to the community. Resources. They have oxygen, non-invasive vents such as BiPAPs, CPAPs, Trilogy units, 24-hour pharmacy, although it's not on site. They do have PT, OT, and ST services, all PPE, including respirators and ability to do droplet isolation, 24-hour RN LPN care with the assistance of medication aides and nurses' aides, IV administration capabilities, including central line placement, midline placement, and peripheral IVs. Doctors are not on site, but they are available via phone. Skilled nursing facilities are able to use full body lifts, and they have lab and x-ray services available, although they are not on site. What they do not have is invasive ventilators, on-site doctors, and, like I mentioned before, on-site lab and x-ray. Some resource gaps are going to be staffing and supplies. For staffing, a lot of agency is used, also staff sharing with other facilities such as sister facilities. And supplies, they need to build up a backup of supplies, and they do facility sharing within their own companies. Infection prevention and control resources, they have access to PPE, follow the CDC recommendations, and they are able to give education. The organizations that help are Centers for Disease Control and Prevention, the Oklahoma State Department of Health, the Food and Drug Administration, and Centers for Medicare and Medicaid Services. Support, they're going to coordinate with hospitals, infection control education, and coordinate home health and hospice services. Some benefits to collaboration is that there are more resources available for all stakeholders. The ability to rearrange patients in different types of facilities, such as less critical patients to a skilled nursing facility, or hospice patients being admitted for respite care, and then they're able to share PPE. Some risks to collaboration are that the resources are depleted faster, and you might have difficulty obtaining buy-in from all sources that the pandemic is actually, quote unquote, a real thing. The impact that the pandemic has, they're going to need to avoid burnout and exhaustion. You'll have a depletion of supplies. You're working with a limited number of healthcare professionals that have already been through something devastating to our community. And I don't think a lot of healthcare professionals are as gung-ho about jumping in and working and fighting as hard as we've had to in the past. Are we ready? I don't think so. There's still a lot of misconceptions on how bad things can be and what needs to be done as far as how transmittable something is, or what treatments are needed, or what PPE is actually effective. There's conflicting information. Lots of different sources say lots of different things. There's a mentality that it won't happen again. It'll never be that bad again. Personally, I feel like that it could happen again, but personally, I'm also exhausted from working through what we've been through. There's a lot of medical professionals that are experiencing burnout, and some people are starting to recover, but I think it's still real. So what can I do? I can provide education on infection prevention. I can provide education on how infection is spread and the disease process. I can give information on how to help coordinate care with hospitals and patient transfers, assist with coordinating home health and hospice care. So no, I don't think we are ready yet, but I think maybe with the more information that we're looking at and the more long-term results that we're seeing on some things that we've already done, I feel like maybe with a little more emphasis, we might be ready in the near future.